hormones are very much involved in how we feel and how we function. This is really important and not sufficiently taken into consideration. And the risk that we miss when we use research and clinical experience based on prepubertal boys that have not entered puberty yet, and once they enter puberty will not exhibit these monthly fluctuations of quite dramatic changes of estrogen and progesterone levels. So firstly, we know that these predictable periods of changing hormonal levels create vulnerable periods across the entire female life, or the entire female reproductive life anyway. So in our research group, we have actually targeted these vulnerable periods in the women's and girls' lives and done studies specifically in youth centers, in maternal health care, and in women's clinics. And these studies, they show that, for example, teenage pregnancies and teenage births are 6 times more common in girls and women with ADHD. And we know that giving birth to a child in a very early stage in your life will affect both your and your young child's psychosocial development across your entire life. So this is something that we wish that girls and women, young women with ADHD also are allowed to plan when they are founding their families. And ADHD girls and women are actually 5 times more likely to experience depression following the traditional prescribed oral contraceptives. And we also have shown that 20% of pregnant women with ADHD will develop postpartum depression and anxiety following birth. And that women with ADHD more often suffer from pain and stress-related conditions during their perimenopausal year. So across the entire female lifespan, there are vulnerable periods associated with fluctuations in estrogen and progesterone levels. 99% of the research is done on males or even prepubertal boys.